Hello, this is Dr. Scott Harrington, DO, coming to you live from my virtual doctor's office, Vegan Primary Care, where you can see a vegan doctor as your primary care doctor virtually from most US states. Not just for a one-time consultation, but as your primary care doctor, someone who'll get to know you and be your health advocate. Because I'm licensed in most US states, even if you move, you don't have to change doctors. If you're vegan, then get a doctor who gets you. If you haven't adopted a plant-based diet yet, but you're still welcome to be my patient. But beware, diet and exercise and lifestyle changes will always be my first recommendation. My goal for you is to take control of your health, and we will work together to get you off chronic medications through a healthy lifestyle, if that's possible. Before we start, I would like to invite you, if you haven't already, to explore the benefits of seeing your doctor virtually through telemedicine. Once you've had a virtual visit, it's hard to imagine going back to your regular doctor visit. With virtual visits, you never have to leave the comfort of your own home, no sitting in traffic or running late, no waiting rooms. It's the future of medicine. Remember that this content is for educational and entertainment purposes only. This video is not intended to take the place of your own doctor's advice. Okay, we are live streaming to multiple platforms, ready to take your questions. All right, let's see, we have several folks on today already. Definitely several folks over at on Facebook. And okay, so we had several questions that were sent in earlier, and I want to kind of point them out, and we can start there. Go ahead and put your questions on that you might want to ask a doctor. I'm here for you, and we'll go from there. If someone wants to come on live and ask a question, reach out. We can put you into the system through a StreamYard invite code if you'd like. Okay. The first question that I got was about the coronavirus. And is there a diet that is most beneficial to help treat and prevent the coronavirus? And so the answer is there's no evidence on this in terms of treating the coronavirus with a plant-based diet or any other diet. There are medications that are used to treat the common cold, like zinc lozenges. And they've actually helped a little bit with the common cold in reducing the days of symptoms that you have. The plant-based diet prevents and treats most of the chronic diseases that put people at a higher risk for the coronavirus, like hypertension and obesity and diabetes. So even though we don't have evidence for direct treatment, we do know that this is the best diet to put you in the best place to prevent the coronavirus. Okay. Here we have some questions. Here is one from Allison. Hello, I am vegan and I've lately been tested for gluten sensitivity. Do you also help patients with these issues? Absolutely. Gluten intolerance, sensitivity. Allison, it is common. 1% to 2% of folks will have this, and it can lead to some serious problems, watery diarrhea and bloating and pain. And so, I tend to tell people not to totally run from gluten if they don't have a known lab tested sensitivity. But if you do, if it's proven, then you should definitely avoid it. Luckily, nowadays, there are lots of options for gluten-free products, and you should definitely not be consuming gluten. And I could definitely help with this if you'd like me to be your provider. I definitely have several patients who have gluten intolerance and gluten sensitivity, and I've treated patients with celiac disease and that sort of thing. So I'm here for you, Allison. That was a good question. Okay. Moving right along, we've got Allison again. Oh, nope, we already did that one. Okay, here we go. Steph, I've been vegan for 12 years. I have calcium deficiency, potentially due to depot shot. Any suggestions? Okay, so this is a good question. So it's actually hard to see calcium deficiency in lab testing. Oftentimes, calcium is more of a transient lab. So people will get labs, they'll see that their calcium is up or down, and it can be alarming. But unless you're having symptoms of muscle weakness, or sometimes the other way, muscle spasms, spasticity, then this could potentially have been a laboma, so to speak, a lab error in the processing of the lab. Now, if Steph, you're talking about osteoporosis and osteopenia, thinning of your bones due to calcium, this is thinning of your bones. Then a typical recommendation by typical doctor visits will tell you to supplement with calcium. That's how it's always been over the years. But now this is starting to become more of a controversial topic, supplementation with calcium. And the recommendation now is everyone should be getting about 600 milligrams of calcium. You can use a chronometer, a free food log that can help you determine if you're getting the calcium in your diet from your normal diet. And this is healthier for you to get this way. If you're having severe osteoporosis, the recommendation is to get at least 1,200 milligrams of calcium. And the goal is to supplement up to that what you can't complete with your normal dietary intake using one of those logs. The reason why it's controversial is because we used to tell everyone to take high dose calcium, and they found that this increases the coagulable state in the blood and was causing people to have, in the population, more heart attacks and clots and things like that. Good question, Steph. Okay, we've got Rosie. Rosie asked, which omega-3 oils should we be mindful of taking? Well, omega oils are a good fatty acid to be getting. We want to make sure that we are getting an inadequate intake of omega-3s. Now, omega-3, the story about omega-3s is these are shorter chains omegas, and the elongated omegas like EPA and DHA, these are the ones that are more bioavailable and bioactive. So you want to be taking 250 milligrams of the DHA. Your body can convert that to EPA if you need that. So that is with an algae-based supplement. That's what I recommend. You don't need to get a fish-based omega. But it is helpful to do this because when you're taking it through your whole food, which I recommend as much as possible, we're getting all our vitamins and minerals from the whole food plant-based diet. So walnuts are high in omega-3s, chia and flax, they're the highest. So if you're eating flax, and I think with chia as well, you want to have it as ground so that you can get the absorption of those omega-3s. Now those will be short chain and your body will have to convert them, and they only convert 10%. So I do recommend a 250 milligram of a plant-based or algae-derived omega-3 supplement in the form of DHA. Thanks, Rosie. Good question. Okay. All right. All right, so Allison has asked, do you see just adults or do you also treat children? It is impossible to find a plant-based doctor for your children. They are out there. I guess they're like unicorns, right? Plant-based pediatricians. So one of the places you can look for to find a plant-based doctor of various specialties in your location is the plantbaseddoctors.org. You can also use PCRM. PCRM has a Find a Doc program, and so docs register there. But yes, I'm a family doctor. I treat patients from cradle to grave, all ages. However, if you have a child under 3 years old, since I'm 100% telemedicine, I can see them, but being their primary pediatrician is hard because in this time you're getting immunizations. But with the help of, unfortunately, with the help of the coronavirus, the government has allowed CVS and Walgreens pharmacies to provide immunizations starting at age 3 and above. So I can see children 3 and above as their primary pediatrician because I can order the vaccinations through like Walgreens or CVS. However, if your child is below that, I would recommend having a pediatrician so you can get those vaccinations. I'm pro-vaccination. I don't recommend avoiding vaccinations. Okay. Thank you, Allison. Okay, so one of the questions that I had was about how do we use vegan primary care? How do we do this telemedicine thing? What's up with this? So if you want to be my patient here at Vegan Primary Care, it's 100% telemedicine. You just go to veganprimarycare.com and you hit book an appointment. That way you schedule an appointment. And when you do that, we get you set up with an electronic medical record. It's all in the cloud. And you can upload your insurance card and any medical information that you'd like, all in a secure manner through the electronic medical record. Then we see each other when it's time for the visit through a Zoom platform, and we have the visit. And you can get the most out of your visit if you go ahead and you purchase a blood pressure cuff that you can have at home, and make sure you have a thermometer and a scale. That way, it's more like an in-person doctor visit where we get the vital signs. And then there's also different devices called the Tyto Care device. If you're wanting the full exam, the heart and lung exam, this can be done virtually using something called a Tyto Care device. I don't think that is the number one thing, because the Tyto Care device is anywhere from $200 to $300, and it may not be required in your situation. So please contact me if you're interested in the Tyto Care device before you go and purchase that, and we can talk about if that would be necessary for you or your family. Okay. Let's see. We have Geraldine Lochran. Are multivitamins good with other supplements, or should you just take individual supplements and forget about taking multivitamins altogether? So this has been a debate. Mainly, I think in terms of population, there's a cost. There's a cost to doing vitamins. And, but honestly, it's probably easy to have a multivitamin if you're concerned that you're not getting one of the recommended daily allowance RDA. But the best vitamin, the best way that vitamins are presented to your body is through the whole food scenario. There's been times in the past where we've focused on doing high doses of vitamin C or high doses of vitamin E to try to get a treatment effect. And the thought process, it seems like common sense. If a little bit is good, a lot is better. But what we found a lot of times is that when the body is flooded with higher doses of vitamins, that you can have unintended consequences, like we talked about with the calcium. For instance, smokers, what kind of started this scare is that smokers that were supplemented with vitamin E ended up having a higher cancer risk, and when they were studied it against placebo. And so what I recommend is for supplements or for vitamins and minerals that are very difficult to get or that you're oftentimes deficient in. For instance, for vegans, B12 is very important because that comes from bacteria. Animals get it, and if you're eating animals, you're getting B12. But otherwise, we're very sanitary, so we don't get B12. So you want to do 500 micrograms of B12 daily or 2,500 micrograms weekly. And then vitamin D, you want to get vitamin D 2,000 international units daily because that comes from the sun. And so, yes, you could take a multivitamin, but the concern there is, it's not too high of a dose, but that one it's not necessary, because most of the vitamins that you would get there would be the water-soluble vitamins that you'd get with the normal diet. As Americans, a lot of times in our mind, we're worried about a deficiency, but probably what's happening with our typical dietary intake is excess. We're getting too much stuff. So I hope that answers your question, Geraldine. A little bit long on that one for you. Okay. Okay, moving right along. Okay, Michelle Townsend Macaroni. Sorry, Marconi. Michelle Townsend Marconi. What is the most respectful way one can address comments from physicians when they say that the patient's medical issues stem from their veganism and that they should start reintroducing animal products? Ooh, Michelle, yeah, this is tough. That's why I started this practice. I want to be for vegans, by vegans, because I don't want you to have to worry about those uncomfortable conversations where you're having your doctor's blaming everything on your vegan diet. So honestly, if someone is not vegan, a lot of times they don't have their mindset in this way. And so they feel like if they're different from me, it's just wrong, or they're not accepting. So I think one of the best ways is to tell the doctor to watch Forks Over Knives. Or so that's a documentary that goes over 4 or 5 patients put on a plant-based diet, and it shows the patients coming off all their medicines. And this was the movie that inspired me to go on a plant-based diet and later become vegan, because typically you're putting more and more medicines on patients, and you're just tagging with more and more. And so this was especially influential for my career, because as a doctor, you want to feel like you're curing people. You want to feel like you're helping. And you start to lose hope when you feel like there's no cure and you're just managing these illnesses. So Forks Over Knives, you can tell them, I know a doctor who said this was the most influential movie in his entire life, and it changed his life. So you could start there. If they tend to be sort of health focused and they're worried about protein, I tell them about The Game Changers. It's a movie that's kind of male oriented, because they talk about, wrestling and fighting and these, male issues, but they also focus on females as well. But that one is one if your doctor happens to be into fitness and bodybuilding and this sort of thing. The other issue, is you could really not broach that subject if you felt like they were really harshly into it, but you could also find yourself a new doctor, I guess, honestly. Okay, thank you, Michelle. Okay, Sharon King says, hey, I've been vegan for 5 years. I suffer from persistent afib. I now have cardiomyopathy and had an ablation last month, currently taking meds, but wonder what else I can do. Okay, well, so you're on a plant-based diet and you have AFib. With AFib, your heart beats and pumps less efficiently because the atrium on the top, the atria, are fibrillating, and they're not packing the blood in for a nice efficient pump for the ventricles to push it out. So you want to make sure that you continue to have the best blood pressure so that this can be managed appropriately and doesn't basically get worse. So being on a plant-based diet, low in animal proteins, it helps with blood pressure. And so the second thing you need to watch out is for salt. So these two things will increase your blood pressure, and that's one of the things you start with. Doctors will review your case depending on your risk factors, and they will recommend, if you have AFib, sometimes they will recommend that you go on blood thinners to prevent a blood clot forming in the atria. So that is something that you definitely want to readdress or address with your doctors. All right, Sharon. Thank you for your question. We do have Jenny Murphy. Advice for gout. Switch to a vegan diet. Okay, gout. Gout is the disease of kings and queens, and where the body will produce crystals in the joints. I like the idea for the analogy for gout. I like to use the analogy of rock candy. Growing up as kids, you may have experienced making rock candy, where you take the sugar and you put it in the pot and you heat it up. At first, you have the crystals from the sugar in the water, and you're making a very sweet solution, and there's crystals there. But when you heat it up, it super saturates the solution, and it'll go clear. All of the sugar will go into solution. Then you pour it into a jar and you put a string there, and as it cools down, the crystals will precipitate out of the solution onto the string or whatever, creating rock candy. With gout, it's a very similar situation, with uric acid being high in the blood, and in the areas that are cool in your system, like your ankles or your big toes, people will start to have those crystals precipitate out, and it causes hideous pain. And so the things that increase uric acid in the diet are animal proteins and cheeses, and they do also suggest that alcohol has an effect, and you also want to be wary of being dehydrated. So these are issues with gout. Typically, when people switch to a plant-based diet, their flares of gout go way down, or they may stop altogether. This tends to be a rich food problem, the problem of kings and queens, and the pauper's diet of a plant-based diet, you tend to avoid gout altogether. So definitely switching to the vegan diet is the way to go, Jenny. All right, so we're moving right along. Okay. Richard Hubbard says hi. Hi, Richard. Okay, here we go. Geraldine Lochran, my thyroid doctor's weight management person told me straight out that at least to do fish like her. I told her soy is a complete protein. She had no idea. Said, can't get enough protein. Would have to eat a lot of tofu. I thought about a nutrition person. I thought for a nutrition person, she knows zero about my nutrition, different from her views. This is true. This is true. So one of the problems that I have as a doctor is if I send someone to a dietitian, the standard practice and the standard training for a dietitian oftentimes contains the FDA and food pyramid, and the focus is on protein. That is because it is national guidelines, and dietitians kind of have to go off these national guidelines. But certainly they know that a plant-based diet is adequate. But I would argue it's the best diet to be on. Foods, for instance, I've had breast cancer patients be told by their dietitian to include dairy, which we know is a risk factor, or the higher consumption of dairy increases the risk for cancer, and told to avoid soy, which is exactly the opposite. You should be increasing your consumption of soy to help reduce recurrence or risk for breast cancer. So this is very frustrating. This is very frustrating. So yeah, you would want to contact a plant-based dietitian. When you're seeing a dietitian, I recommend that you make sure that they're plant-based so that they're more aligned with your views. And I'm sorry that you had to go through that, Geraldine. Okay, Richard Hubbard. Hi, Richard. He asks, my dad has COPD. If he went plant-based, would that help heal his lungs? Well, we know that COPD is a long and chronic issue, and thickening in the basement membrane of the lungs, where you just have decreased diffusion compared to younger and healthier lungs. So this is a problem, and as far as I know, I don't have evidence to say that there is reversal of COPD. I will say if there's any asthma component or autoimmune component, that asthma tends to be helped by a plant-based diet and decreased inflammation and this sort of thing. Stopping smoking is, of course, the number one thing. I can't promise that you will be able to improve COPD with a plant-based diet, but if there's any inflammatory component of asthma, that would definitely help it. So that's a very good question, Richard. All right. Okay. All right, so I'm looking back here. All right, here we go. Okay, so Geraldine, she's mentioned that before many people are deficient in vitamin D, so I started taking that in addition to my B12. She thinks she may be very deficient because during my blood work for a thyroid appointment, it was found to be very low or deficient in vitamin D. Yes, that is a typical. Okay, so Geraldine had, even though she was taking vitamin D, was found to be low, and so this is something that happens. You know, it's interesting when we take pills, we worry about the absorption of the pills. Is the vitamin D that you're taking being adequately absorbed? And it's hard to tell people, do you take it on an empty stomach or do you take it on a full stomach? Because on an empty stomach, vitamin D is a fat-soluble hormone, and so it is probably better to take it with food. But if you're taking it with a lot of high-fiber food, it can trap some of the fats and make it harder to absorb. So it's I recommend taking the vitamin D with food and increase it to your dose until you're hitting those numbers, usually above 30 in the blood. So you're doing the right thing, Geraldine. Okay. All right. So I also wanted to pull back on. We have 3 minutes here. We have 3 minutes for a 30-minute visit. Does anybody have any last questions? If not, what I want to tell people, if you're on right now and you like what you're seeing, go ahead and like the live broadcast. Like it for me. If you're on YouTube, subscribe. That would really help me out and getting the word out there for vegan primary care. If you can, share the broadcast to help get your friends into it as well, because we want as many people on board as possible. The plant-based diet can help treat and reverse the chronic illnesses and many of the diseases that when people are given to initially feel like it's a life sentence, but who knew that you could actually treat and cure these diseases with diet? Okay, Jenny Murphy, she has a question here. One more question. Do vegans need to avoid mushrooms or cauliflower? On the contrary, Jenny, G-BOMBS is Dr. Furman's recommendations for plant-based foods. He is what he calls a nutritarian. What foods have the highest nutrients? G-BOMBS: greens, beans, onions, mushrooms, berries, and seeds. Mushrooms are they increase the immune system's activity. It's probably helpful we know that mushrooms increase the immune IgA, the immune cells at our mucous membranes. So it's probably helpful in preventing different viral illnesses. We're not sure about coronavirus, but cauliflower is a cruciferous vegetable, and it is very helpful. It has chemicals in it that are cancer fighting. So yeah, all of the cruciferous vegetables are very important to eat. Dr. Greger from nutritionfacts.org puts it on his daily dozen of fruits and vegetables that you should be eating daily, to include some cruciferous vegetables. You might be worried about nightshades, for instance. Nightshades, some people have rheumatoid reactions, autoimmune reactions to nightshades, but you would want to confirm that with testing because I don't recommend the plant paradox, the concern about anti-nutrients in plants. This type of concern is just going to get you to not eat the healthy foods, and it's going to get you to narrow your diet too much. So I recommend go ahead and eating the nightshades and so on and so forth. So Thank you for, oh, Jenny, the question was in relation to gout. Do you need to avoid those in relation to gout? No, so the biggest concern are the high purine animal products and cheeses, and alcohol and dehydration. All right. Okay. I just wanted to conclude here that thank you for participating in this live event with me, Dr. Harrington at Vegan Primary Care. I look forward to doing a weekly broadcast to answer your questions. Once again, thank you for your questions. For everyone who's participated today, I really appreciate it. This makes it fun for me and hopefully fun for you. Share it out to get people involved. And till next time.